So, good evening, students. Today we are going to discuss about your second chapter, which is related to the activity and occupation, and how activity and occupation are directly linked with your occupational therapy. So, first we will discuss about activity. What is activity? Throughout a day, we do lots of things. Throughout our life, we do lots of things. And second, culturally accepted things we do and our surrounding people do, we call activities. And in other words, the activity is a kind of action human being take according to the circumstances, according to the need. Like playing, cooking. When he's hungry, he start cooking. According to the need. Playing. When he feel entertainment, he start playing. So according to the need and circumstances. Action taken according to the need, according to the circumstances by human being, it's called activities. Yes, second we have occupation. Occupation is something like activity, because in occupation we do lots of activities, but with a specific characteristics. That's why occupation is different from activity. Activities we do all the time, but when we do some occupation reflects some characteristics. For example, suppose a driver is driving a car or a truck, so it's a specific characteristics. Now, how activity and occupation are directly linked with the occupational therapist? The main reason is the activity is the model of occupational therapy. When any occupational is going to treat a patient, they have to follow some procedures, and the procedures are a referral, screening. They have to check the patient referral, they screen the patient, then evaluation and intervention. So first we will discuss about referral. Suppose as a therapist I am going to treat a patient. How come? We need to check referral first. A referral could be from their parents, from their caregiver, from the doctor, from a practitioner, or from a rehabilitation center. And second thing, referral could be specific or general. How specific? Maybe the practitioner order for splint, and in general maybe the specialist or a rehabilitation manager request for the assessment of development delay. Second, we have screening. So screening, when we have referral, the therapist starts screening patient. Screening manual, they start asking question, face-to-face conversation. And one more thing, why the therapist do screening? Because from the screening he can understand whether the patient need evaluation or not. Because when you discuss with the patient, you have his history, then you understand, yes, this patient need evaluation, or no, this patient don't need evaluation, something like that. So screening is very important when you're going to evaluate and intervene your patient. Now the next is evaluation. Evaluation is a kind of assessment by the therapist of the client. So in evaluation we do assessment, we do observation. Sometimes the observation could be known by the client, or could be unknown by the client. And assessment, sometimes assessment could be non-standardized and sometimes standardized. For example, the manual muscle testing. We do as a therapist we do manual muscle testing, and functional independency testing or functional independency measurement. So this is all kind of assessment, which sometimes is standardized, sometimes is non-standardized. Now the second step is intervention. Intervention means to say we are going to treat our patient because we have referral. After referral we screen our patient. Through the screening we have his history, everything. After screening we evaluate our patient. Now we are going to treat our patient because we know everything about our patient. So to do or to perform intervention, we have to follow some procedure which includes, the first is adjunctive, second is enabling, third is purposeful and occupational based for a successful intervention. So now we are going to discuss for the first, adjunctive. Adjunctive is the initial step of the patient treatment, where as a therapist we educate patient, we give education to a patient about the what we call about the meaningful activity of on the daily basis. For example, we educate patient about strengthening of the muscles 1 or 2 times a day on a daily basis. Second, we providing electrotherapeutic agent which help during muscle strengthening, relaxation of muscles, movement of muscles, etc. So this is all comes in adjunctives. There are a lot more comes in adjunctive like relaxation technique, coping technique, meditation, all kind of mandatory movement on daily basis of the client. Then next we have modality. Modality mean model. Model mean the way to proceed, the way to treat a client. So every treatment have this specific model and the therapist follow that model and treat the client according to the model. Next we have enabling activities. What are enabling activities? Student, enabling activity, the purpose of the enabling activity is directly linked with the motor pattern. Motor pattern mean to create a situation for the client so that he start doing his own practice, he start doing his daily basis activity perpetually. Cognitive skills. We are trying to instill cognitive skills in enable activities or under the enable activities so that sooner or later clients start their daily routine activity without any help. Next we have purposeful activities. Purposeful itself speaks the purpose of the activity. So the meaning is also same. Purposeful activities mean the activities which is meaningful for the client. So mean to say, if any client have the goal to do a garden at home, suppose one client have a purposeful activity or meaningful activity is do a garden at home. So what therapists do? They start giving training of gardening during session. So this we call purposeful activity. I'm just giving one example. Now the last one we have the occupational based activity. You know what happened in occupational based activity? Occupational based activity is same like the other activities, cognitive, purposeful, enable activities. But you know what happened in occupational based activity? The function of a therapist is going to decrease in occupational based activities, and the client is start doing his daily based activity, instrumental daily based activity perpetually. So far so good, student. This is all about activities and occupation and how activity involved in occupation. In next lecture I will find another more topic and we will discuss. Till then, thank you very much and take care.